like I said, we've been meeting with doctors and providers, and they're saying that it gets more constricted. You know, providers took a 10% cut for Medicaid patients. They're saying another 5% cut. They're gonna reach a point where it's not worth it.
Well, in the first place, the quality of the services being provided are timed by seconds now on our wristwatch, which the doctors. A lot of these people go to see a doctor, and it takes them weeks before they can see one. Well, it's pretty obvious it's only gonna get worse, not better, because we all have to realize, insurance companies are for profit, and that's never seems to, we don't seem to comprehend that. And they contract physicians, and they tell physicians, you're gonna see these patients for these amounts of dollars. And if more people are gonna be coming in with less money, then it just all, it's a big snowball effect. And what I'm seeing for these seniors is their Social Security did not go up this year, but the price of milk certainly did. The price of eggs certainly did. And so therefore, they are not eating properly, and their health is being affected. So everybody, even though you're grandfathered in, your quality of life is lessened, and your health needs become more.
But see, anybody that's 55, that's not covered by Medicare, would then move into this,
Right.
to this new plan. And what the doctors are saying is that, a private insurance plan is gonna be more expensive than the traditional Medicare plan, no question about it. And so even as they're waiting for this population to come into the voucher program, the government's contribution to Medicare is gonna slow down on the budget. So it's gonna be less and less and less and less. And that's always gonna have an effect, even on the people that are grandfathered in, it's gonna have an effect on quality of service. And like I said earlier, we all have complaints, we see them in our office about Medicare all the time. The waiting period, I can't see a specialist because the insurance company won't refer me. But as you really well said, if it can be a pain now, it's really gonna be a pain, because there's gonna be less choices for people. The concern that I have over, ¿necesita que explique la primera parte de la junta en español?
La mayoría de aquí de las personas saben inglés.
Ok, muchas gracias. No de cortesía para darse.
No, porque sí, bilingües.
Bilingües.
O necesitan que
Si tienen preguntas, después con todo gusto.
Después tienen una pregunta. Okay. I can't, that's good, because it will spare me torturing you, the rest of you with my Spanglish. But the next area, the big deal for me, and it didn't, nobody talked about it, and this budget resolution that we passed on Friday, the Ryan plan, had in it two things. Let me tell you. It creates an unprecedented fast track procedure to that you will be able to do Social Security cuts. Under the plan, under Ryan's plan, any year the Social Security is not at the 75-year balance, and right now we're always there. A couple of years we slip behind. So let's say 4 or 5 years from now, we slip down, we don't have a balance of 75 years. A balance being, we've got enough money in the trust fund to pay everybody's benefits for 75 years from that point. Let's say we slip down and we only have 73 years. What happens then is that it goes to Congress. And Congress then can decide how to make up the difference. And you can only make up the difference out of Social Security. So in the past, Social Security has not been part of the federal budget per se. It is a separate trust fund. Now, what this plan did, it brings it back into the federal budget. So that Congress can then, the House of Representatives primarily can say, okay, you're not at the 75-year balance, you're 2 years behind, we wanna get you back up there, and so we're gonna, and the only way is to cut into Social Security. And we know that even with any changes, with no changes, Social Security continues to be able to provide its beneficiaries for 7 decades to come. Do we need to change some things to Social Security to make it better and more solvent for the future? Yes. I think you have to raise the income cap so that the ones that are making $500,000 in retirement pay the same percentage as somebody that is not making $500,000 in retirement. That would automatically create a huge amount of money into the system. The plan also calls, the Ryan plan also calls for, in 2022, that the retirement age would go from 65 to 67. It's not gonna affect some of us, but certainly that generation that's in their 50s right now, and there's plenty, they're going to have to wait 2 extra years before they can get. And what we forget about Social Security is that 13% of the people in Social Security are children, and about 11 to 14%, depending on how you count it, are persons with disabilities. And so we're forgetting that that group is affected by every one of these decisions. So we have, and the last thing is Medicaid. Medicaid is the last safety net out there in healthcare. What this plan does is it turns it over to the state. It says here, state of Arizona, state of Minnesota, you run it. But there's no strings. You know, sometimes we get mad because the government has strings. Well, in the case of Medicare, Medicaid, I'm glad we have strings. Because you have to have a basic package of coverage, and you have to kick in a portion in order to receive the money. With no strings, and it becomes the full discretion of that state. That means they get to set eligibility, they get to set the copay, if there's going to be one, and there will be one, and they get to set the reimbursement for providers, doctors, and hospitals. All that will have an effect, and we are, if you go on what the state did with already on its waiver where it knocked off about 125,000 people from eligibility, this last thing, $538 million cut, then you can assume that that pattern is going to continue. And it's not just because Arizona's legislature is a little bit crazy. That's not the only concern I have.
No?
The concern is that, I don't care if it was a democratically controlled legislature that we had. The idea that you can turn it over to the state for them to use that money to offset other things, no. It's supposed to be dedicated to healthcare, period. Those are the 3 things I wanted to talk about. But before I finish, it's not just about me and many of us in Congress saying no. We're not just saying, no, don't cut Medicare, leave it alone. No, don't touch Social Security, fix it but don't ruin it. No, don't dismantle Medicaid. Yes, we said no, but we also have a solution on how to deal with the deficit and how to deal with preserving these programs. The American people right now, and particularly older Americans, in survey after survey after survey after survey, 80%, 81%, 70%, 67%, depending on ages, all agree that these 3 programs should be left alone. Medicare, Social Security, and Medicaid. Over and over and over again. And so when you ask those same people, and you tell them, well, we have a deficit, somebody has to sacrifice, we have to make some cuts, we can't building up a debt and a huge deficit, they agree with you. 90% say you're absolutely right, we can't keep going this way. Then you pose the question, how do we do both? And they, American people are smart. Very smart. They talk about, okay, quit giving all these subsidies to gas and oil, 40 billion a year. Okay, maybe the top 1% has had it pretty good for 10 years, it's time to pay their fair share. Maybe we close all the tax loopholes on corporations and overseas stuff. Maybe we need to cut in areas in the military on weaponry that is no longer useful. We should not be building weapons from the Korean War in order to keep an industry alive when there's no use for it. And maybe we need a fair tax system. And maybe everybody has to share. Because this is about sacrifice, okay? But you gotta share it across the line. And the budget that was approved in the House, what did it do? It changed those three things badly, in a bad way. Social Security, Medicare, and Medicaid. But what it also did is that it gave further cuts to the 1%, took the corporation tax rate from 35% to 25%, and increased the subsidies for gas and oil.
When they're
It went
profit.
totally opposite. So what's gonna happen when there's no revenue coming in? The revenue responsibility was a shift. And those middle class, working folk, your grandkids, your sons and daughters, that are out there, are middle class or wanna be middle class, they're gonna end up paying more to make up the difference. And it's a tax shift. It is one of the worst tax shifts in the history of this nation. Nobody likes taxes. Nobody likes them, you know? I mean, and nobody likes to talk about them. You try to run away from them. But we have an economic crisis in this country, and I think it's time the American people talk honestly with each other about what the hell we're facing here. But that doesn't mean that we all of a sudden turn our backs on fundamental programs that has served us well. So what we're proposing to the Senate, because we lost our fight in the House, and what we're proposing to the President is put everything on the table. We're gonna talk about spending cuts. Don't just cut 4% of the budget. Put everything on the table. Everything should be on the table. And those areas that I mentioned to you, the subsidies, the financial loopholes, you know, and God bless our men and women that have been fighting for us in Afghanistan and Iraq. God bless them. There's not enough we can do for them. And no amount of gratitude is gonna equal what they've gone through. But that war, those two wars have cost us $1.7 trillion. With no offset, there's no way to pay for it, it's just, and I think that a very responsible redeployment, to use a nice word, getting us out, to use the real word, would in the long term save us human capital and financial capital. And it's not about making our national security any worse than it is. I mean, if somebody could prove to me that everything is so stabilized in the Middle East right now, that the mission is accomplished, I'd like to have that discussion. I think it's reached a point that we need to start pull out. And that would be, in the long term, a tremendous amount of revenue and savings that could be used again to shore up some of the programs that we have. Bring it back and start spending it domestically. That's where we're at. We're urging the president that if these things show up on his desk, Medicare, Medicaid, Social Security, and the cuts are not in areas that are not that should be looked at and are not looked at, that he should veto the legislation and make him do it right. That's the power he has, and the Senate has a great deal of power. Sad to say, what happened in the House is not gonna be the final product, cause it's so ugly that I think you're gonna have trouble passing it in the other. But I don't want us to set, some precedents where we do start, undoing programs and say it's only for 3 years or it's only for 4 years. Once you start on this path, that's why the fight over Social Security is always constant, because once you start, you open up the box, it's gonna be really hard to put the lid back on it. So, that's it. That's why we're going around and talking to you. That's our opinion. We did a sign-in sheet so we can send you all the information that we have on this topic as it happens. You need to let the people that are making decisions for you in DC, that includes myself, know. And not just the people that agree with you, but the people that don't hear from you often. We have colleagues that all voted for this stuff that haven't heard from any people that they're affecting. And if they did their duty in our home, going and talking to their constituents at senior citizen centers, at nursing homes, at hospitals, they're gonna hear a different tune, and I hope they did. We thought that this is of such urgency that we don't wanna wait till the middle of May to come and tell you what's going on, tell you now, come back and tell you again. But we're pretty much committed to making this a really drawn-out fight. This is too important for us to concede. And like I said, we're not just saying no. We're saying no, but this is how you do it. And we have an alternative, and we're gonna push that alternative. Is there any questions? I can try to ask them. If they're really specific, you're gonna be in trouble.
Why does the Ryan budget go after the senior programs?
There's been a myth that's been developed that Medicare and Social Security are the reasons that we have this deficit. The rising cost of healthcare is a reason that we're in this economic, no question about it. It's one of the biggest contributors. But doing this to Medicare is not gonna control health costs. The way you get out of that hole is to control health costs. And so far, private insurances have no competition, none. You know, it was the most cynical thing. We're debating the health reform bill. Whether you liked it or not is kind of irrelevant right now. We're doing that, and right after we passed it in the House, and right after the Senate kind of passed something else too, the premiums went up 10 to 15%.
Or better in some places.
25 in some areas. My mom's, not my mom. My godson, who's a corrections officer, for the state, his thing went up 27%.
It's not
like
just the
that.
premiums that went up, but the premiums went up and the benefits went down. They got less benefits. A lot of things were taken away, which cost money. So even though you're paying more.
So the Ryan budget does nothing to control health costs, which is the reason we spend so much money. And one of the things that we have to do is look at controlling those costs. If you don't control the cost, people continue to complain about Medicare costing more. Of course it's gonna cost more. The services that Medicare is purchasing every day is costing more. But that's not an excuse to blame Medicare for the rising healthcare costs when they're not. We're just we pay out. We don't set the cost level. And I think Medicare, and let me give a good example of the Veterans Health System. They're probably one of the best health programs out there. And why? Because they purchase their drugs in bulk. For everybody that's on a veteran benefit, they'll go to the pharmaceutical company and say, okay, we have 8 million patients. Give us a cost. then they pass that savings down to their beneficiaries. When they deal with insurance, this is what we're gonna pay, and this is the coverage we need for our members, and they get it. And I think maybe the attitude with Medicare has to be the same way down the road. And since we don't have a public option to compete with the private insurance companies, and this is what's so dangerous about the voucher, okay? The little coupon that you would take, is that you have to go to a private insurance carrier to redeem it. So the point that you well made, less benefits, more cost, and you're capped. So those people that are 55 now, that are not at Medicare, potentially are gonna be kicking $6,000 out of their own pocket every year to keep their health coverage. And by the time we all get to that point, I don't know, we don't got 6,000 laying around every year to spend on that.
And guaranteed that it'll continue to rise because it does every year. Again, so long as insurance companies, which are, again, for profit, that's exactly what they wanna do. They wanna make sure there's more money in their pocket, and your healthcare, my healthcare, is not profitable if they're having to pay out. You know, when you have to pay for something, that takes money from your account and puts it somewhere else, so that's not profit. You know, so, we continue to see this as a real problem, just because we, like you were saying, for these people to go and get their Medicare, their pharmaceuticals, that they go to Walgreens, that same pill will cost them this amount. If they go to Walmart, it costs them this amount, and they have to know where to go. Well, most of the seniors do not have the know-how, the capability, or whatever you wanna call it, to be able to do all these things. And they're asking seniors to understand things they do not understand, and every year they make them want to understand more things they don't understand. And there is absolutely no reason why their high cholesterol medicine is so much more here than here. They shouldn't have to make those choices.
Yeah.
You know, they shouldn't have to know that this is cheaper here than over here. You know, this is not for them to have to do anymore.
Sir.
Yeah, we have Medicare, and I have to have an HMO as a supplement, because Medicare will only pay 80%, and the HMO will cover the 20% of the pharmacy. My wife recently had a total knee done. What do you think it costs for her total knee? Just one total knee, what do you think it would cost?
Just for the hospital.
Just for the hospital, give me a ballpark figure.
40, 35?
47,000. And where does that money go? 47,000. Is the doctors getting all this money?
No,
Who's
it
getting
was
the
No,
money?
they
just the
got a fixed
hospital.
reimbursement.
No,
It's ridiculous.
it was just the hospital. No physician, no physical therapy, no drugs. They were all separate. So this surgery that I had is outrageous.
Was it a knee replacement?
Yes.
Yeah, total knee.
My mom had that, but that was about 10 years ago. And just to tell you how it's changed, it was maybe 28,000.
Well, I had the other one done 2 years ago, and it was 32,000. That's how great it has increased.
That's the healthcare cost.
That's
You
incredible.
gotta- and unless we control those, we're still gonna, sir, you're gonna be asking the same darn question, what the hell is going on?
Yeah.
Because there's no control on the cost, and then Medicare, that 80% still has to hit, regardless. And so then you have people that go, look at Medicare and all the money that it's spending, but there's no cost controls on both the insurance, the carrier, there's no cost controls on providers, and so now you're gonna lay a cost control on Medicare, which means a further cost control on you. The providers and the insurance company will have no cost controls. They'll continue, in 4 years, the bionic knee will be about $80,000. But there's, see what I mean? That's the control mechanism that frustrates me so much, that we're blaming Medicare for healthcare costs, when all it is a payout source. You're just responding to the cost that's been set, you know?
Actually, Medicare places a standard on payment because this, the doctors could, or hospital, let's say, they'll say it's $100,000 for this, for the person who comes in without insurance. But Medicare says, we only pay X amount of dollars for this, so now it went down to $75,000. The poor Joe that came in that didn't have any insurance is gonna pay $100,000. And then Medicare says, no, this is only worth $75,000, so minus that 25, and we only pay 80% of that 75,000. So Medicare actually has kind of reined in some of the costs, if you will, but not sufficiently enough to, because.
The other thing that happened in this budget, we had closed the donut hole on Medicare. This budget opens it back up again. So those people that are caught in that income issue, we had it closed, kept it closed, and now the budget opens it back up again.
I have a
Oh.
question.
Yes.
It's like, is that medicine is the same thing? My husband got a kidney transplant, and the medicine cost, the entire rejection was $1,100. At that time, during these years, I even paid $275 a month for co-payment until I thought it went down to $120. How much do you think it costs right now, the same medicine?
I have no idea.
$11. And you know why? Because the company, the pharmaceutical company, have 10 years period.
Yes.
And then they can move, but the 10 years went, and they get the same price until 18, almost 18 years. We got it at $11.
Right.
Then we ought to contact our senators and let them know.
Oh, yeah.
And what should we tell them?
Well, I think we have to be very straight with those offices. That is, as citizens and people of this country, we're really concerned about the deficit, that something should be done, and that there's ways to deal with it. But the changes being proposed in the Ryan budget on Medicare, Medicaid, and Social Security are unacceptable to you. So come up with a different plan to deal with this deficit, and basically, we're not gonna be happy if you mess with these three. That's about it. I mean, public opinion, if a politician tells you they don't care about public opinion, they're lying. And sometimes I should have cared more, but that's another story. The issue is, poll after poll, and public after public is saying no. And I think they need to know that.
Which senator is this?
I don't know, I keep forgetting who, I'm just kidding.
You only got 2 months. We only have to.
I'm sure.
Write both of them.
Yeah. But, any other questions? We're gonna keep, y aquí al centro ya hablamos con Richard y María y todos los que están aquí. Vamos a mandarles informes de lo que está ocurriendo con Medicare, el Seguro Social y Medicaid. Clara, porque trabaja en mi oficina, está encargada de ahí. Va a asegurar que vamos a mandar a alguien a asegurar que tengan esa información aquí. Some alerts, we'll send you alerts, and if you, that's what we ask you to sign in. Some of you will, that are not part of the center here, we'll mail it to you. Those that, we'll be dropping off alerts about where all this process is so you can keep up with it. A list of phone numbers and names that you should probably call and be talking to.
Grijalva, Presidente Obama dijo que él mientras fuera presidente no iba a dejar pasar
Exactamente, y lo que anteriormente dije en parte de la plática es que también tenemos que informar a la Casa Blanca que ese compromiso que hizo el presidente es muy importante.
Sí.
Now, the question is, what President Obama said that as long as he's president, that Medicare, Social Security, they're not gonna get touched.
Yes.
And that he would veto legislation and all.
Pero él ya está
All,
listo para negociar otra elección, ¿verdad?
So,
La elección.
I think it's also important to let the White House know how you feel. We'll send those out, because.
Yes, in the context though.
Because we feel like that is a strong commitment on the part of the president. Dynamics being what they are, van a comenzar a negociar. The Senate and the White House and the House will begin to negotiate, and they can negotiate on where to find the money. It's just that I think we have to be real insistent that you don't go looking at these three programs. And the White House has to know the same thing.
Mr. Brown, just one question I have. You know that you talked about the 1% and that they went down on their taxes. How is this allowed? Is it through our Congress people? I mean, how is it feasible that they do this to the American people? I mean, they must realize that these are millionaires, billionaires, whatever, and yet this is allowed to go on. 25% to these people is an enormous amount of money they're not going to pay.
If you're a millionaire right now, based on the Ryan plan, your tax return next year, you get an extra refund of $125,000.
That is so wrong.
And I pay.
And you have Warren Buffett, who is a billionaire. His reception is at a higher tax bracket in terms of what she pays in than he is. GE, General Electric, got away without paying any taxes last time around, and got a refund on some of the losses.
But I don't understand how this happens.
Well, it's about power, it's about influence, and it's about the fact that they have the ear right now of the people making these decisions. But as my dad, as my dad and other people used to say, there's more of us than there is of them. And I think the political process in this country allows us to have a big influence. And I think the influence comes from letting them know. You know, the pharmaceuticals at one point had almost 3 lobbyists for every member of Congress. The insurance company had almost 2 lobbyists for every member of Congress. Gas and oil had almost 2 lobbyists for every member of Congress. And financial institutions, Wall Street, 2 to 3 lobbyists for every member of Congress. And so they have influence. They help fund campaigns. They help people get reelected, and they have influence. But I think when people get a real look at this budget that was passed in the House, when they see how we're, we're further dividing this country based on income. You know, that the whole thing with my parents, they busted their behinds. You know, my dad wasn't educated. He could working as a laborer, so that me and my sister could go to college,
Did you sign
get a better
Would you like to?
life, and we did. What makes me sad
That's
right
okay,
now
we can
is
send them in
there
Spanish
might be a
too.
generation out there
Lo podemos mandar en
that we
español
can't
también.
promise them the same.
Si quieres,
And I think
nos
people
pones
are
tu
getting
nombre
fed up.
y tu domicilio.
Anyway, thank you. Appreciate it.
Thank you.